think we'll go ahead and get started today. We might have more people join as we go on, and that's great. So on behalf of Superior Health Quality Alliance, I'd like to welcome you to today's event, Empowering Nursing Assistants Through Thoughtful Leadership. And we're so excited to have Laurie Porter sharing her expertise with us today. So my name is Toni Kettner, and I'm your co-host and moderator, and Jill Hansen is also a co-host and will be helping moderate some of the questions and answers and chat function. And both Jill and I are from Superior Health Quality Alliance. We're quality improvement advisors. And I'm sorry, did I misspeak? It's Jill Lindwall. I think I may have said Jill Hansen, so I apologize for that. We have two Jills. So definitely Jill Lindwall is here today, and she is my co-host. So thanks, Jill, for your help. So the purpose of the event today is to provide an opportunity for networking and sharing about opportunities to fully engage and integrate nursing assistants in improving quality care in nursing homes. And we know how integral nursing assistants are in that process. Just a few housekeeping reminders today. The session today is being recorded, and it will be posted to the Superior Health Quality Alliance YouTube channel in about 5 to 7 days. So we will also be sharing the link to that YouTube recording in some of our e-newsletters and on our engagement platform, which is Superior Health Connect. So you can watch for both of for the recordings to be posted in both of those areas. All of the attendees are muted today. And if you'd like to make a comment or ask a question during the session, please use the question and answer function. And to locate that, you might have to use your cursor or your mouse to kind of hover over the bottom of your screen, and it should pop up for you. There'll also be an opportunity for those of you who may wish to ask a question live to Laurie at the end of the event, and we'll review both of those opportunities at the end of the presentation. If you're having trouble with the Zoom function, Jill is monitoring the chat function, so just send her an email message and she'll do her best to try to help you problem solve. And then also the slides for today, as well as the evaluation link for the event today, will both be posted in the chat box. So without further ado, it is my honor to introduce Laurie Porter. And Laurie is the co-founder and CEO of the National Association of Healthcare Assistants. Laurie started her career in long-term care more than 35 years ago. She began as a dietary aide and then moved into a CNA position for about 7 years, became a nursing home administrator for another 7 years, and then eventually became an operations director for about 10 skilled nursing facilities in the Midwest. So she has lots of experience in long-term care. In 1995, Laurie followed a dream and created the National Association of Healthcare Assistants, or NAHCA, to honor and recognize CNAs and other frontline care providers who serve our nation's frail, elderly, and disabled individuals, as well as to elevate the profession of nursing assistant through professional development, advocacy, and empowerment. And if you've heard Laurie speak, you know she's very passionate about those three things. Laurie and her staff have grown NAHCA to a membership of more than 30,000 members nationwide, and NAHCA has a partnership with more than 800 nursing facilities across the country. Laurie is a nationally sought after speaker and author of the book, Everything I Learned in Life, I Learned in Long-Term Care. What a great title. Thanks again, Laurie, for joining us today.
Well, thank you, Toni and Jill, both of you, for assisting on this and playing host. And thank you to the whole Superior Health QIO Alliance, Quality Alliance, for putting on this important webinar. There's never been a worse time to try and do something great out of a a great opportunity coming out of a bad situation. And COVID spread the light, shine the light front and center on our workforce challenges in long-term care. and specifically that of the nursing assistant, who through our data appears to provide over 90% of the direct patient care a resident receives. Now, and we're not saying CNAs do 90% of the work. We're saying they provide 90% of the direct patient care that's delivered in long-term care. And so, first off, that bio, I'm going to need to cut that down a little bit. It sounds like that was a whole lot of Laurie Porter on there. And but the truth of the matter is, I'm really, really proud of my experiences, because they have led me here today to be able to be with you and others across this nation to talk about this important topic, and what are we going to do, and the strategies of the past didn't work in the past, so we're not sure to regurgitate those will have any better luck in the future. So we have to look at really the culture of the workforce. Sometimes I'm occasionally misunderstood, because I talk about the first culture change that needed to change was the workforce culture. There's very few happy employees in a nursing home, from the administrator on down. So first off, I want to say to the administrators and DONs who may be joining us today, today's not about what you've done wrong with me. I think there's a country that has no understanding of what your two roles and responsibilities are. And to think that management can fix this problem alone is misguided. So I apologize for all the workshops you've been in all these years to keep your CEUs, where you've been pounded on about be nicer to your staff, be better to your staff, be better to your staff. And in some respects, you're thinking, how much better can I get? It's still not working. So I am a practical speaker. I won't say I'm a great for every audience, but hopefully if I do say something you disagree with, you'll put it in the chat or ask for clarification, or in the Q&A, and ask for some clarification. What I want to focus on today is a prescription or a recipe, if you will, of what a team needs to be successful. And really, nursing assistants are part of a team, and yet we're constantly looking at what can we do about the nursing assistant situation. Well, we can't just fix the nursing assistant situation without first fixing what's ailing us in long-term care from a bigger perspective. We have a terrible reputation across the nation. No one wants to live with us. No one wants to work with us. And we're just in one of those caveats where we stand on an island alone. And very few people do necessarily want to respect those of us that do work to care for our nation's elders. So the recipe that I go by are every team's 9 fundamental needs. And you can put these team needs in any situation. If you're in assisted living, skilled, hospital-based, in almost every area where there are sports teams. These are the 9 fundamental needs. And that's what I want to focus on today, because each and every organization should do. And I know that one of my associates that's on the webinar today will post the 9 team needs in the chat. I'm a bad speaker and was non-compliant with Tony. As much as she tried her best, she could not get me to turn in slides in time to be formatted with the proper approval. So for those of you that are joining by computer, you should be able to see those in the chat at some point. But the very first of the 9 fundamental needs is to feel a sense of belonging. I want to give you an anecdote to start out with about why we're struggling so. Everybody, there's no one in long-term care that's not burnout today. Everybody's at their wits' end. And now we have this mountain to climb of not only rebuilding from COVID, but rebuilding our staff, our teams from days gone by, where we have really been under the gun with survey, with these staffing challenges just make everything worse. And so how do we create a sense of belonging in a nursing home or in a healthcare setting in its entirety? Well, let's talk about that for a minute. A sense of belonging. I have yet in my now 40th year, 41st year, I think, if I really admitted it. Yes, this is 2021. So in my 41st year, I'm saddened that we're in really no better place than we were in 1980 when I worked my first shift as a CNA. We had 3 call-ins that night, and so we were short. The very first night I was orientated, and that was 1980. So in 1980, when just a little bit about my quick story of how I got here to understand these cultural impacts in nursing homes is, I never I didn't answer a calling. I grew up in the Ozarks. I'm speaking to you today from Missouri, about 45 miles north of the Arkansas state line. We're hillbillies. And hillbillies don't achieve much in life. We're never supposed to make it out of McDonald County, actually. If young women drop out of high school because they're pregnant, nobody raises an eyebrow. But the summer between my sophomore and junior year of high school, I got addicted to soap operas. So I decided I'm going to be the first famous hillbilly out of the Ozarks. I'm going to move to New York City and get a job on All My Children with Erica Kane. I'm going to be a soap opera actress. Well, so I quit school. I didn't discuss it with my mother. She comes in the next morning to wake me up. Laurie, you're going to be late for school. I said, Mother, yesterday was my last day. She said, I don't suppose you graduated early. I said, no, ma'am, I quit. She said, well, honey, if you're not going to go to school, you're going to get a job. And I said, yes, Mama, I know. I'm moving to New York City. I'm going to be a soap opera actress. Mother and I lived in a 1-bedroom apartment behind Tina's beauty shop in Pineville, Missouri. She said, girl, you better get a hold of yourself. You don't even have enough money to get out of town. You're going to get a job here. Well, it was a very small area, so I knew what jobs were out there. There was, we didn't have any chain fast foods. It was the mom and pop dairy cone, hamburgers and ice cream. And then there was several chicken plants. I come from the poultry capital of America. And so I said, okay, I'll go to Dairy Cone. She said, oh, no, you won't. You're coming to the nursing home. See, she was the dietary manager of the local nursing home. Now, this is one recruitment thing that you could look at, is if mothers made all their children go to work at the nursing home, it would help with our staff shortages. Mother made me, when you're 17 years old and you've told all your friends you're moving to New York City to be a soap opera actress, you don't rush home, call them up. Guess what? New York's off. I've had a better offer. I've been hired on down at the nursing home. They're like, what? The chicken plant wasn't hiring? Because I understood in 1980 it was more popular to work at a chicken plant than a nursing home. But 41 years later, I can't quite figure out why we're still there. Why is it still more popular to pluck chicken than to take care of an elder? We really have to think about that, because inherently we are in a country that doesn't really like to grow old. And we keep our nursing homes on the back streets so we don't, I think it goes beyond ageism. There's a difference in people like myself that are soon to be in the 60s. We all don't want to get old. And there's plastic surgery. I haven't had any, as you can tell, but there's plastic surgery all over the place. Everyone's trying to look younger, be younger. The last thing they want to do is see old people who are incontinent, who drool, who don't look right. So we keep those folks in nursing homes, and only those of us that are willing to be warriors in caring for our aged, are there to pick up the load, to do what we want to do, to fulfill our mission in life. But we sure could make it a lot easier if we had some cultural help from the outside. But to create a sense of belonging should be very easy in a nursing center or a healthcare center at large, because there's one goal, just one goal. And it says it in the regulations through and through for nursing homes. And that one goal is to help each and every resident reach their highest practicable level of functioning. That means the resident is the goal. And as long as you have a goal, a team can be tied strong to that goal. But part of the reason the goal isn't first and foremost in everyone's mind is because we have a terrible challenge with leadership across the healthcare spectrum because leaders don't share their vision. I've worked for a lot of administrators, and I have never yet, and in all my 41 years of consulting nursing homes, I've yet to find a single administrator or DON who has a vision. Your own what do you stand for? Who are you? What do you want this team of yours to accomplish? What is the goals? What do you see? What are you trying to create? I can't follow you if you don't tell me what you want, where you want to take us. But if you can articulate why we're here, if you can articulate it with your vision, and I don't care if you have to meet one-on-one with every staff member you've got, and I know some of your campuses are probably have over 300, maybe up to 500 employees, and you're thinking, what? I can't possibly meet with them all. We've got to figure this out because you have got to ensure that anyone, especially in the CNA role that is the closest to the residents, the patients we care for, they must understand your vision. Because here's the kind of things I would hear as a CNA in the all staff mandatory all staff meeting. Matter of fact, I was in a facility not too many years ago that still used their overhead page, and I was there to speak to CNAs, do a motivational talk. This was the announcement I heard from the administrator over the intercom. CNAs to the dining room. The mandatory in-service motivating yourself to achieve begins in 5 minutes. I had to crack up laughing. Mandatory motivation. I mean, that is not the way to get the buy-in of the staff. So, first step, create your vision to create a sense of belonging. Make sure I realize I'm in that vision. I'm a part of that vision. Because the staff meetings I attended as a CNA, most of the time, they said things like, I'm all about quality. I am all about quality. From this point on, our culture is about quality care. And I'd be the CNA on the back row going, oh, thank goodness, it's finally about quality. Maybe I can get that new shower chair where I don't have to be the fourth wheel on the one I have to use right now that I've been lifting up for the last month. If it's all about quality, I know we'll get that new chair. So I rush up after the big quality in service that it's all about quality and said to the administrator, Jeff, how about that new shower chair? I need that new shower chair. He goes, Laurie, it isn't in the budget. I'm like, what the happened to quality? You know?
Oh, Laurie, I'm just wondering if I want to make sure that we have plenty of time, and sorry to interrupt, but that we allow folks to have some opportunity to ask questions at the end. So you've talked about the sense of belonging and having a vision that you're really clear about, that you're able to share with others. So are there practical strategies that administrators and DONs can implement to?
Yes. Those strategies, my apologies. Thank you for jumping in there because I can get carried away on the soapbox and lose it all. So the experience and what I was leading up to with that sense of belonging is because once they belong, they're in. So that strategy is a must. And so how we can do that is in a number of ways. But before I get to those number of ways, I'll tell you what nursing assistants expect from their employer. We're brought in because we want a social model at the front line. But all CNAs see is what they can't do, what we can't have, what we can't afford, what's not in the budget. And they grow tired and believe that there is a lot of hypocrisy. People talk quality, but then there's no real investment in quality. So what a new CNA, what a nursing assistant expect? They expect to know that progress is being made. I know Bessie likes the pink shirt on Tuesdays. I know Frank likes the linen change on Fridays. His full linen change and full bath. I know all these things about a resident, but that's not necessarily a measurable outcome. If we are all nurses and CNAs fit in this same role because it's a 24-hour experience. So they have to know the only way to not burn out is to really see that progress is being made. So one of the things I encourage all care centers is to create a scoreboard for your CNAs. So they can have some specific goals, that it's not just up to here's another day. Yes, we've had 3 call-ins. This is your 27 residents today. I'm sorry, but we had these call-ins. Do the best you can. Those are not inspiring or lifting up a professional. And they see that so much in their world. There's never been a time where CNAs are more frustrated and angry than they are today. So nothing beats communication. There's no tricky message. There's no promo material that you can create until we address the fact that we need a call to action to recruit the type of folks we want. We have to let people know who we are and what we're doing. And this takes communication. So you can go to workforce investment boards and all the various things that organizations tell you to do, but it's about inspiring people to want to care. If you are going to have opportunities to talk to new recruits, inquiries, I say don't roll out the red carpet to where they feel you need them more than they need you, because that sets up a terrible situation. However, you have to understand that what keeps a true CNA coming is the fact that they don't have a job. They have a relationship with the residents. That is what's carried us through this pandemic, is not they had a job. Because we all know there's places that pay a lot more than what nursing facilities are capable of paying. So there's 2 kinds of benefits, and you need to know these. Logical, that's the pay. The benefits, the PTO, that's things that can be measured without an explanation. You can put those on paper and everybody understands a logical benefit. What we don't do well at is the portfolio of benefits that we have that most other businesses and companies don't have, and that's the emotional benefits. Yesterday, I had an opportunity. I got a question on millennials, and someone said these millennials don't want to work. I said, I'll hire millennials all day long. No, you're right. They don't want a job. They want to make a difference. So you have to know who you're hiring, who you want to make up your team. And when you decide, all CNAs are not alike. If you are a trouble care center, then you need to have turnaround nursing assistants. You need to hire for what you need. And so we treat all CNAs alike, and all CNAs are not alike. And so in our world of long-term care, we can't really operate like every other employer because we are different. So knowing that progress is made, create a scoreboard for your nursing assistants and potentially even your nurses, but they see a little more outcome. So for example, if an administrator in DON says, we have got to get our falls down at this facility, we have got to get our falls down. And next month, there's another in-service that said, nursing got our falls down. CNAs do not feel like nurses. That does not resonate with them. When really, nursing assistants got the falls down. And that's who should get the credit for getting the falls down, not nursing. Nurses and CNAs are 2 different folks. CNAs do not respond to anything that's directed at nursing. So why is that? Because CNAs, it might surprise you, only 6% of CNAs want to be nurses. If finances and childcare and things like that were not standing in their way, still only 6% want to be nurses. So I think that surprises a lot of people because we bill nursing assistants as an entry-level career. We need to stop doing that. Most CNAs I know, hundreds of thousands of CNAs have been in this profession more than 10 years as a nursing assistant. That is not entry level, that is career. So be clear exactly what you want on this team. You can't hire, there is no litmus, there's no single CNA that's just like another. And to try to put them in a box like we have all these years and not empower them. So the 9 team needs to know what's expected. A job description does not describe what's expected. You must, and there's ways you can communicate. I will encourage you, if you are using an ERA, an electronic payroll system, and it has the ability to communicate directly with your staff, take whatever time is necessary to import their contact information in there, because I've been in a lot of facilities that use a couple of different companies for that, and yet they still do not, they haven't taken the time to populate it with the information so they can communicate directly with their employees. But this is one of the greatest things in the digital age that you have, because you can reinforce messages, you can reinforce your vision to your team without calling a staff meeting, without posting it on the bulletin board. We have to now teach and share information with folks utilizing the technology that has made all that much easier for us. They have to feel challenged by their work, and not just the bad challenges. How do you recruit? Do you say CNAs wanted, all shifts, apply within? Bad practice. What do you want in your team? Advertise for it, and then no one's going to come in ready for it. We must develop people. That's all there is to it. We can't expect people to come in and with the first or second or third day because of an emergency, throw them out there. However, I will encourage you as leaders to do something that I found very, very helpful, and that is you can create a flag. I mean, it was a facility that came up with this, but I was telling them there's a disaster plan for every disaster at a nursing home except the disaster that happens every day. And that's the disaster of staffing. We have a disconnect. Everybody in the facility says they're willing to help CNAs, yet CNA says no one will help. Where's that disconnect? Well, has your care center, has your operation created a plan, a disaster plan for staffing that communicates directly to the team? As I said, this one facility developed a flag system. If the flag was green, it was flying high. If it was yellow, that meant they'd had 1 to 2 call-ins, and therefore you opened the playbook, and dietary knew what they had to do, housekeeping knew what they had to do, nurses knew what they had, department heads knew what, everyone knew what to do to help. But to just say I'm willing to help and not find out how to help, or for nursing assistants to say nobody helps without telling someone how to help them, communication, communication. What strategies could, okay, so Tony's flipping through and hopes I'll read some of these, but I cannot read and talk. So Tony, I will never feel embarrassed or anything. Just break in when you need to. I've got about 3 or 4 more of these, and they'll go very quickly because they're all so closely related.
Okay, that sounds great, Laurie. So we can get to the last couple of questions and stuff.
Absolutely. So they want to feel they're, so I wanted to say with the challenge, here's the challenge that I believe CNAs stand up to the test of time, and that is, do you have what it takes to meet America's elders' needs? Are you somebody who can step up to the plate and grow your skills and ability to help me create this vision, to see this vision through? Okay, so we've covered challenge. To feel their contribution means something. So that is recognition. And I'm sure there'll probably be some questions around that, because it's easy. You think your CNA's constantly, a thank you would be nice. I know you're telling them thank you. The problem is thank you is not enough for them, and they just don't know how to articulate it. What they really need is for you to make me feel important. Make me. Not all the CNAs. We give group praise because it's easiest. No, and that's fine to give some group praise, but here's what we've done. If 30 of our CNA staff are excellent and 10 are, we'd replace them in a heartbeat if we could. We had great applicants. They're getting the same praise your 30 superstars deserve. So what we're doing is reinforcing their bad behavior by saying, hey, we got a great survey. I couldn't have done it without you guys. CNAs rock. You're reinforcing 10 people's bad behavior, and you're taking away the true recognition that the 30 should feel because they worked their tails off to help you get that deficiency-free survey. Your power of your leadership and the power of your influence is not to be taken for granted. I know administrators and DONs have to be feeling pretty low right now. But again, if you can, find the courage and the energy and the excitement to inspire your future and existing care force. I don't like to call it a workforce because residents don't want workers. They want caregivers. So I believe we here at NACA, we're developing a care force to be kept informed. Again, that's all your digital opportunities that you have to populate. And they really must have confidence in their leaders. That's all there is to it. They must have confidence in your leaders. This is such intimate work to them. They think that anyone who can blow it off. I had a member the other night ask, a CNA ask her, why do you go the extra mile? None of the rest of us do. Why do you stay here till it's all done? No one else does. She said, because I like to sleep at night. I like to sleep at night with a clean conscience. We need more CNAs to be able to articulate that. So we haven't invested in and empowered our current nursing assistants to be able to have those conversations. I was written up twice as a CNA for my negative attitude. I know all of this. I was a bully. I knew how to get the administrator and DON to do what I wanted them to do. Stop being manipulated like I was able to manipulate you out of desperation. And invite me to be a part of your team and ask me to help you make a difference. Ask me to be part of your vision. That's what I need to feel empowered. Otherwise, I feel like I'm on the fringe. They must have confidence in their leader. They don't have to like you. It's not a personality contest. They must have confidence in you. And they need to feel rewarded. And that is not little trinkets. That's not gold stars. These are not children. These are adults. Nothing feels better than being held up in front of other people and someone in leadership or someone of they consider important says something nice about them. And if not to other people, if Tony and I can see Tony real well here. So it would be like if I was looking right in Tony's eyes and she was across my desk. I know what she's wanting from me. She's wanting me to make her feel worthwhile, make her feel important. So I would say, Tony, I like the fact so much that you are willing to speak out. You're willing to ensure that people's questions are answered and that the speaker just doesn't burn up time and no value. And as a presenter, I, for one, appreciate that very much. And I have enjoyed working with you and your team on this session. That is a compliment. That's not, Tony, good job. Tony, thanks for hooking up the webinar. That's not it. A compliment. Do you know it's easier to write someone up than it is to compliment them? Try it. Try bringing in a few of your staff one at a time and lay down some real compliments because they need it right now more than ever. If you've got superstars on your team today, stop, take some time this week and next week to meet with those stars and tell them one-on-one, eye to eye, what they mean to you and to this operation and to this care center. And they will leave there walking 10 foot tall. The problem is you may have to tell them again in 3 months. It takes a lot to fill a caregiver's soul and to feel rewarded. And then lastly is share in the planning. They must share in the planning. I would always ask my CNAs when I was an administrator and they would just complain, oh, we're so short staffed, we're so short staffed. Don't we have any applicants? Yeah. We have a bunch of applicants from CNAs who quit without notice. You want me to hire them? I don't know. No. Well, they were good when they were here. I let it be their decision because then they own those people. I mean, they have some level of ownership in the success of these CNAs returning. We've all had to hire people we wished we didn't have to because of desperation. But the greatest thing you can do is develop, and then I'm going to let Tony ask me some questions. But one of the most empowering things you can do is develop. We have a certified preceptor certification course, but you need to make sure every recruit you bring in has the best experience possible. So we have to limit and make sure that the nursing assistants on your team that are training the new hires, whether they're certified or uncertified, that they know what mentoring truly is. The turnover happens in the first 3 weeks. So we can identify it's a bad experience in the beginning or we wouldn't lose people. And we can't simply say, oh, they didn't want to work. That's not true either. We do not create good onboarding experiences. The old thing, I was not too long ago, I saw an onboarding, well, before the pandemic, I saw an onboarding where that every department head comes in and introduces themselves. Don't do that unless you have a department head who is going to inspire and set them on fire, because a person is never more focused and teachable than the first day on the job. So you have to make sure, don't set them in front of a bunch of boring tapes. Look at your onboarding practices and elevate that experience in a professional way, not in a desperation way. Okay, Tony, where are we at? What do people want to know next? Or
Well,
I'm sorry.
yes. So thanks, Laurie. I think you've really covered about what nursing assistants are looking for and what they find fulfilling and satisfying. And you've given, I think, folks some ideas for some strategies that they could implement that would empower their nursing assistants, and then in turn would improve the quality of care for the residents. So I think just moving on to the next questions here. So how, with with so many things happening in the nursing homes right now, the surveys have restarted. They're still dealing in some cases with COVID-19, trying to open things up and deal with all of those kinds of issues. What are some practical ways that they could implement, a nursing home could implement these empowering ideas into their communities and still be able to provide resident care when faced with the significant staffing issues? And then any insight on how that could be done without jeopardizing care?
Well, there's never a good minute to take a CNA off the floor. We know that, and it'd have to be even more so now with our staffing situation. We have about 200,000 openings for CNAs across this country today. We'll soon be going into Texas with a very robust recruitment campaign, as well as a career placement opportunity for the providers there. And we calculated Texas needs 12,000 CNAs like 5 months ago. They're about to call a state of emergency. So I understand that nursing home administrators and DONs are probably constantly being faced with how not to jeopardize care any further than it already is today. So the best thing I know at this point in time, Tony, to say is, if you can single out your superstars, you need to keep that team as robust as possible. Do whatever you can to energize. If you cannot, I saw a whole team of nurses slept on a Zoom meeting where the administrator and DON wanted them to understand what our association was before they gave the memberships out to the CNAs, because they wanted the nurses to support it. And I have to tell you, 3 of the 7 slept and the other 4 did charting. And no one paid a bit of attention, nor were they interested. So anything you do that's great on the onboarding side can be undone by somebody who isn't on board with the vision. And so you really have to limit their experiences in the beginning of who they're exposed to, because not everyone knows how to make the best of this bad situation. It is really a toxic relationship and has been for many years between nurses and CNAs. And so I think if I had to chip away at anything right now without jeopardizing care further, it would be to bridge that divide and figure out in your care center, because every one of them is, you all are different. You're the same, you got the same challenges, but the reasons you have those are different. And so I would say right now, do a needs assessment on your staffing situation. Know exactly what you need, how many you need, and where they need to be, who will train them, who will onboard them, who will speak with them in the first week of their, and do not waste anyone's time, because the first day is when they're most focused and teachable. So, once we're out of a critical situation, there are many other things that can be done that will not jeopardize care. But most of what I recommend requires some meetings, and that's been very difficult for facilities to pull together. I mean, they've been met to death between CMS, CDC, guidance coming from public health, from state and local health. I know everyone is just so confused. And many of you probably took part in the Project Echo, where they provided a great deal of education. And then I know Project Echo called on me to see, why can't we get more CNAs on these calls? And I said, well, you simply just don't know the plight of nursing homes right now. There's no CNAs to put on a call. There's an administrator could very easily, I've tried to educate people that don't know us well. So for example, I tell Project Echo all the time, you don't know nursing homes, and the second they figure that out, they're not going to sit on any more 90-minute calls, because they may be doing post-mortem care right now, and in 30 minutes they're going to be on a Zoom with their corporate office. You never know, because we are all hands on deck. So you want me to take the next one, Tony?
Yeah, sure. So we've talked I think those 9 areas that you talked about regarding team, I think were very helpful to folks. So if we could just talk about, maybe share a couple of examples of like empowering the CNAs and building some of the processes that you've talked into your systems.
Sure.
What effect does that have on customer satisfaction, staff satisfaction, quality of care, survey outcomes? And if you could provide a couple of concrete examples, that would be really helpful, I think, for folks.
Certainly. Well, there's plenty of those, but one that stands out to me is, first off, many of our CNAs across the nation have been leaders in their facilities, have accepted leadership roles. Facilities have decided to build a unit of CNAs who are charged with more or less being the cheerleaders, being the consultant to the administrator and DON. They hear everything that happens on the floor. And if you haven't created a challenge, I call it building one team. So I believe that a nursing home administrator needs to engage their folks in roundtables. I'm not talking learning circles. I'm talking, the reason the CNA gets upset when my administrator said, oh, it isn't in the budget, and I'm thinking, what happened to the quality? I'm leaving there thinking he's a hypocrite, because I don't understand. CNAs don't understand so much about the business they're in, and NACA has always played a role in helping them understand reimbursement. Because if Sam Walton would have been told he could only charge $200 a day and serve 100 customers, and he had to provide whatever they needed, there wouldn't have ever been a Walmart built. But we find ourselves in this situation with limited resources, and almost everything we try to do jeopardizes something. But the best thing I could say is, if I were administrator again, I would develop a budget and finance committee among my staff, and I would pluck two or three people out of each department to be on this budget and finance. And if you walk up to a CNA, you got to know how to speak to folks. So if you walked up to Laurie Porter, CNA, and Tony was my administrator, and she said, Laurie, I'm putting together a budget and finance team. I'd like to have you on it. Would you do it? I'll go, no. Why? Because I'm embarrassed. I failed math. I got kicked out of pre-algebra 3 times. How in the world can I can't even balance my checkbook. I'm not going to tell her that. I'm just going to say, no, I don't think I'm interested, because I'm not going to want to embarrass myself. So Tony has to know that about me. Be wise enough to understand CNAs they're not going to jump at that chance. So I've got to invite them in a different way, Tony. I have to say, Tony, I'm putting together this budget and finance committee, and I don't need necessarily for you to know anything about budget and financing. I just want you at the table because you know a lot of things I don't know about our resources, our washcloths, our inventories, what they're utilized for, these type things. Now, all of a sudden, you got 3 CNAs, 1 housekeeper, 1 dietary aide sitting in a break room. And when somebody goes, I can't believe we get paid what we get paid, they have some level of understanding of why things are the way they are. And you're not an island by yourself as 2 leaders trying to make everybody feel important. You have created a team. And you can spread that out. The finance is my favorite one because so many of our employees have no idea what it's not in the budget means. They think you're a tightwad. So when we put together a course called Budget and Financing 101 in our learning management system, I got a call from an administrator and said, why in the world are you teaching them nursing home budgeting? I said, what do they know about it? He goes, I don't know. I said, they only know this. It isn't in it. That's all they know about the nursing home budget. Whatever they need isn't in it. And we have to change that. And so the only ways to do that and to empower them is to bring them to the table, invite them in a way that resonates with them, that tells me I don't have to be embarrassed if I can't spell something. You're not counting on my spelling. You're not counting on my checkbook management. You're counting on my expertise at what I do. And that's what we have to communicate to people when we're talking to them. And it is empowering, off the chart. It increases staff satisfaction. Think about this for a minute. We no longer have the choice but to improve staff satisfaction. According to the last, and I don't think my researchers put out an annual report since 2007, but in 2007, it clearly depicted the largest clearinghouse of employee satisfaction in nursing homes states that the least satisfied employee is the CNA. The second least satisfied is the nurse. The 2 people closest to our residents and patients are the least satisfied. Do you know who the number 1 most satisfied employee is in a nursing home? The business office manager, the person furthest from the resident. So if you were just out there and didn't know better, would you not think that means the resident is the problem? Because the resident is their job. For nurses and CNAs, the resident is their job. So it's sending out very poor signals in terms of marketing or making our profession shine. So anyway, anyway, I'm sorry, Tony, just I keep going and going, but satisfaction does increase when people have a role to play in the bigger picture.
So I'm just going to invite anyone again who would like to make a comment or ask a question of Laurie to place that in the question and answer function. And again, to find that, if you use your mouse or your cursor and hover over at the bottom of your screen, that should show up. There's also a raise your hand function if you want to make a comment or ask Laurie a question directly. And once you click on that, then Jill and I will be able to unmute you. So while we're waiting, Laurie, to see if there's any questions or comments, I'm just wondering, how can how does empowering the CNAs relate to quality of care and survey outcomes? Can you just comment briefly on that? We've talked a lot about customer satisfaction, staff satisfaction, but what about the quality of care and survey outcomes?
Well, I have to be careful with this one, Tony.
Okay,
You
fair enough.
you gave me some orders, so I got to
Yes.
try to play within the lines today. By the way, I put my email address in there because I did see someone asked about, is there a PowerPoint? What I can say is if you email me, I'll send you the Building One Team format that talks about the budget and finance, and it outlines the entire program of how to enter, how to bring all the team together. But to get back to your question, obviously, there are some metrics out there that would indicate that CNAs do not have an impact on clinical outcomes. I don't care for that data because I refuse to believe that CNAs don't create better outcomes when we have fully staffed CNAs that are professional and empowered. But so much we've sent so many negative signals to CNAs. Don't talk to the families. Don't tell them we're short-handed. Don't this, don't that. There's very few do's that are around speaking to my soul. I'm afraid to talk to families because every time a CNA does, they end up in trouble. We asked the other day, we had a webinar and we asked a medical director because, he was just so robust and it was terrible for me to put him on the spot this way. But I said, Doctor, many CNAs call here daily asking, what do we do when a resident's had a significant change in condition and nobody will pay attention? We can't get our nurses to go down there. We can't get anyone to go down. And so many times this has resulted in broken backs and civil money penalties and things that could have easily been avoided if CNAs were looked at as the experts the families consider them to be. No one considers CNAs an expert except the families and the residents. And that's where, if you think about it, this whole COVID without the families being in there, most of CNA's recognition comes from the families. They will search out a CNA to say, thank you so much. Dad looks so great today. You don't know how much I appreciate that. That's the kind of things that make a CNA tick, but we don't provide it in the workplace nearly as much as we should and could. But the quality outcomes, in my opinion, only improve when we have the staff that's necessary in which to do person-centered care. And my estimation, and that of CNAs, and we have discussed this in a lot of different formats, and it may surprise you, but although most of our metrics say that we'd like to shoot for a 1-to-10 ratio, 1 CNA for 10 residents, maybe even 1-to-8, you'll hear some people say, but CNAs themselves think 1-to-12 that they could perform. And I put it to them, I said, I want makeup, full makeup, not just some blush on my cheeks. I want the full paint. Tell me how many you can take care of if I have everything. And they still maintain that they can do person-centered care on 12 with 12 residents. I would find that hard. We've all taken care of far more as CNAs than 12. So I still believe I'm good. I like 10 because if we're truly into person-centered care, then you can only do for 10 people what I've already done for myself today. I've gone to the restroom 7-8 times already. I fixed my hair a little bit, not too much. Put on a little makeup, got dressed. I've actually gotten dressed twice because I had to dress for this. So there's no way we can do that for more than 10 residents and do it as well as we all aim to. So in retrospect, I'm going to ask you, if you do nothing else, get your core group of CNAs together and spend some time with them, asking them what's important to them, why they feel let down, why they feel what could improve, and don't just be active listening to that. and you'll find out a lot of info. Now, they won't tell you everything, but they will. If you ask for their help, they'll give it. The problem is we rarely ask or engage them.
Thank you for that, Laurie. Just as again, I don't see any questions in the question and answer pod. So please, again, feel free to do that. And
Here
while
comes
we're
one.
waiting, oh,
I don't think I got it, but I saw one pop up. Oh, nurses and CNAs don't always see eye to eye. Do you have any suggestions on how to bring nurses and CNAs together at work as a team? Yes, as many team building exercises as you can possibly bring in that will be especially difficult, that they will absolutely have to work at as a team. Don't let them pair a nurse and a CNA together, not two nurses and two CNAs, no competing against one another. It's a collective team building. And if you'd like to email me, I think I put my email in the chat. And again, I'd be happy to share any kind of resources that we have with your audience today, Tony.
Awesome.
If
you want to send those also to me, Laurie, we can make sure that we share.
Oh, absolutely.
And that gets to a much broader audience. So that would be awesome.
Absolutely. I'll send those resources to you and you can get them out to the group.
Okay, perfect.
Tony, I believe had her hand raised.
Oh, let's see. Are you able to, I don't know if let's see that. Jill, are you able to see?
Yes, I just had a hard time getting her
unmuted. So while you're doing that, just briefly, I want to go back. If you haven't had a chance, take a look at our, I'm going the wrong direction here, at our Superior Health Quality Alliance Frontline Forces modules. They are designed specifically for CNAs and other direct care staff in other settings. So we've got a lot of great modules and more coming soon. So
and you're the only QIO that has reached out to us that we know of that's doing anything like the Frontline Forces. So great job.
Thank you. Jill, are you able to unmute the individual that wanted to ask the question?
Yep, it's taken care of.
Okay, perfect. All right, thanks. And then the other opportunity that we have, which is also, I think, something really important for individual organizations, is a reminder: if you haven't completed your organizational assessment, please do that. That's a great opportunity for you to identify areas of opportunities for improvement as an individual organization. It also helps Superior Health identify best practices that we would love to share with other organizations, and also helps us really have a better idea of what educational opportunities and technical assistance that nursing homes may need. So again, if you haven't had a chance to take a look at either one of those two opportunities, please feel free to do that. We've got just a couple of minutes left. Are there any other questions or comments for Laurie?
Thank you, Laurie. Hearing your perspective is really beneficial to really, shape what's happening today in healthcare.
Well, I appreciate it, and I will take the no questions as a sign of a good job instead of a bad job today. It's a tough topic. I mean, it just seems like right now there's no good answers, but all we can do is try to make lemonade out of this lemon. And I'd be happy again if anyone wants to reach out.
And there is one question.
Yeah, I see that too.
As a recruiter, what do you think is one of the most important things to ask?
So,
what their view of aging is.
Okay, awesome.
And I also highly encourage you to have a resident in on the interviewing. It's their home. And I've seen a lot of CNAs get jobs because the resident may ask them the same question 7 times within the hour or within the interview. And the CNAs that answer it every time as if it was the first time it was asked, those are definitely hireable people.
Great answer. Well, we're coming up at the top of the hour. So again, Laurie, just on behalf of Superior Health, we are so honored that you were able to join us today and provide expertise. It's been a wonderful opportunity to learn some new things, and I'm sure we're all, the participants are ready to go out and try some of these things in their organizations that they may not have already thought of. So once again, thank you. And best of luck to you, and hope to continue to hear from you and run across opportunities to hear you speak again. So many thanks.
Thank you. Appreciate it.
All right. Take care.